Hello children, let me welcome you to the virtual class of the Brihan Mumbai Mahanagar Palika. My name is Shraddha teacher. Children, we are in the middle of this COVID-19 pandemic, and because of that we are not able to go to school, but that doesn't mean we are going to stop learning. So we are going to do many lessons which are very interesting from your textbook through the virtual class here. So let us do a lesson in English today. So children, I'm back with this lesson in standard 8th English, and looking at the image, you must have already guessed which the lesson is. So yes, the lesson is lesson number 4.2, Revolutionary Steps in Surgery. Now we have done part 1 of this lesson, children. Last time we talked about surgery in general and what are the steps and procedures that we take when we have to perform a surgery or when we have to undergo a surgery. Okay, and along with that we also talked about certain grammar points, and we discussed the grammar points first because they came up in the warming up part of the lesson. So we talked about clauses, we talked about conjunctions, okay, and then we also talked about these coordinating words and so many other things we talked about relating to the warming up exercises. And then I told you that when we come back and meet again in the same lesson, we will continue doing the lesson and we will try and cover the remaining points also. So here I am with part 2 of the lesson 4.2 in your textbook, Revolutionary Steps in Surgery. Now we will actually go to the lesson today and look at the content of the lesson, and later on we will look at some comprehension parts and also a vocabulary exercise. So we had discussed this picture, children, if you remember, and we talked about how the person who's the patient there is in such a difficult situation. Look at the pain on his face and see how he has grabbed the bed in order to keep himself steady. Okay, and you can also see that he is a wounded soldier who has been brought in from battle. Okay, and we discussed that there is no electricity. That means there are absolutely no facilities or no amenities available to the person or to the patient in this particular situation. Now this is how surgery was conducted in the ancient times, okay, in the olden times. Now if you take a look at today's picture, so this is surgery which is being conducted in the modern times. So you can see how the doctors are all ready, the nurses are ready, and you can see a console where there are a number of complicated machines, okay, which are helping to solve the patient's problems. And you can also see that this is a surgery which is being done by a robot. So actually there is no human touch there. No human is touching, or you can say operating or performing the surgery upon the patient. So what is the human being doing? Human beings are just guiding the robot. And you can see they are also able to see inside the body. Can you see a small camera? You can see a small monitor over there where they're even able to see what procedure is happening inside the body. So can you see, if you compare this picture quickly with this picture, we get an idea of the kind of progress that human beings have made as far as medicine is concerned. Okay, so there are so many different points regarding the surgery that we are going to see now in the next few minutes. So see, we call Sushruta as the father of surgery. Okay, it is said that he was the first person who performed different kind of surgical procedures. So look, take a careful look at this particular image, children. You will be able to see in the first image how surgery is actually being performed, and there also you will see that people have held the patient down. In the very first image, if you see, people have held the patient down. Why they've held him down? Because he is not able to bear the pain. There is no anesthesia which has been given to him. We discussed about anesthesia also. It is a kind of drug which puts you to sleep. Okay, so you do not realize what is happening to you. It makes you unconscious for some time. So we talked about Sushruta. You can see a picture of Maharishi Sushruta over here on the screen. You can also see that they are working upon some vegetables. See, they have some gourds with them, some pumpkins with them, out of which they're extracting certain things. in order to do certain kind of surgery. So they used natural things mostly in order to conduct these surgical procedures. And Sushruta is said to have been the person who performed the first plastic surgery. So now what is plastic surgery, children? Plastic surgery is a kind of correctional surgery. If someone doesn't look so good, if someone feels that I don't look very good and I want to improve upon my looks, so now plastic surgery is an option which is available to us. If some people get burnt or they suffer in an accident and their face is mutilated or they look a little not good, and if they want to look good again, they can go in for plastic surgery. Okay, so this is about Sushruta a little bit. See, this is how dentistry was performed in the ancient times. Can you see nowadays also we go to a dentist and we get these you can say clips inserted on us on our teeth. All right, but the modern clips they are sometimes not even visible. You cannot even see that they have those braces. So you can see these are one kind of brace which an ancient dentist has given to a patient. But remember, here it was very difficult for the patient to bear the pain because at that time there were no kind of anesthesia available. Okay, anesthesia became available only from the mid 19th century. So till the mid 19th century, operations were all very painful. There was nothing like painless surgery. Painless surgery was not possible because anesthesia, whether it is ether or whether it is chloroform, was not available. So it must have been very difficult. Just think about it. See here, another dentist working on the patient, and you can see how he is actually pulling out his teeth, and you can see the amount of distress on the face of the patient. So some ancient surgeons, they also did the work of removing teeth. So now we have specialist doctors who do that. Okay, we do not go to a general physician to treat our teeth. We have a specialist doctor called as a dentist who treat our you can say problems related to our teeth. Okay, so this is how our society has progressed, science has progressed, and therefore medicine has also progressed. So now here you can see anesthesia being given to a patient, and you can see how coolly and how comfortably the patient has been put to sleep. Now, there are certain kinds of anesthesia which is called as a general anesthesia. So, when general anesthesia is given, as in this case, it benumbs the whole body. Benumbs means makes the whole body numb. Numb means what? You will not be able to feel any kind of pain. And there are certain kind of anesthesia which are used locally. That is, if you have to do some kind of surgery on your tooth, then only your mouth will be given anesthesia. The doctor will take a syringe and give you an injection on your gums. So only your mouth will be under anesthesia, not your whole body. Okay, that is called as local anesthesia. Now let us look at the types of surgery which are performed. Now we are going to have certain pictures which might disturb you, but remember children, we are reading or we are learning only things which are written in the textbook. Okay, and also remember, just listening to something will teach you less, but if you see it, if you see the pictures, you will learn more. Okay, so we will look at the types of surgery now. So the very first type of surgery or major type of surgery is called as cardiac surgery. So can you see what is this? This is our heart. So have you ever seen your heart? And the kind of typical drawing that we do for our heart looks very different. See here, this is the human heart. All right, it is beating away inside our body, and naturally you're able to see the heart means that the doctors have opened up the body of a patient in order to perform some kind of surgery. So cardiac surgery or heart surgery is available on a wide basis today. You can go to any hospital if you want to get a heart surgery done. But then this was available only after 1893. Before that, doctors did not know how to treat the heart or how to operate upon the heart. Okay, so you have these heart surgeries where you repair so many different parts of your heart. All right, so see here, this is your heart, and there are so many parts to your heart. So you have the arteries, you have the aortas, you have different kind of valves inside your heart. So if there is any problem with any of these parts in your heart, the doctor will operate on it and solve your problem. Okay, see, this is how an open heart surgery is conducted. In an open heart surgery, you open up the chest cavity of the patient and then you operate directly on his heart. All right. Whereas we also have these kind of surgeries where the body of the patient is not cut open, but there is some kind of instrument which is inserted inside his body. So here you do not have to cut open the patient. So these are the different kind of heart surgeries which happen. All right. Sometimes there are certain problems with the valves in your heart. I showed you the valves here. See, these are some valves in your heart. Okay. So all these open pipe kind of things are the valves. So if there is any problem in any of the valves, see here also there is a problem in the valve, they're trying to solve it. All right. So this is called as heart surgery or cardiac surgery. Now the next kind of surgery is surgery which is conducted on your brain. Now the brain is also a very, very important part of your body. Okay, now this is also a very recent, you can say, development in the field of surgery, that is neurosurgery. What do you call it? You call it neurosurgery because along with the brain, you also treat the spine and you treat all the central nervous system of your body. So now what do the neurosurgeons do? They operate on the brain, or they operate on the spine, or they operate on the nerves. Now they treat patients who are very small, up to people who are very old, or people who have some other kind of issues, like people who have suffered a stroke or something. Okay, so this is a brain neurosurgery. This is the second kind of surgery. See here, if there is some issue with your brain, they try and solve it with surgery or with operation. There is one more very, very advanced kind of surgery in today's times, which is called as robotic surgery. Now, what is the meaning of robotic surgery? This is the most recent, you can say, development in the field of medicine, that is robotic surgery. Now, it is a kind of surgery where you do not have to make a very big cut in the body of the patient. So, we saw the open heart surgeries, children, where the chest of the patient has to be opened up. But look here carefully, you will see that in these kind of robotic surgeries, you have to make very tiny incisions on the body of the patient. Can you see? See such tiny holes they have to make in the body of the patient. That means the patient heals better, the patient heals faster. All right. So this is all the, you can say, benefit of doing robotic surgery, which is widely available in today's times. See, this is how robotic surgery is done. See, it is a robot which has got inside the body, and the robot is doing the work of operating on the patient. So this is a robotic surgery which is in progress. Now there are certain terms, children, in the book which we will discuss along with these pictures. Okay, so now till now we discussed about the three kinds of surgery. So one of the more common ones is the cardiac surgery, or the surgery which is done on the heart. Then also we have the brain surgery, or surgery which is done on the brain, which is called as the neurosurgery. And then we have a robotic surgeries, which are the latest in the field of medicine. Now these robotic surgeries, they also give a more detailed view to the surgeon. You can see there are two small screens available. There is one screen, and under the screen there is one more smaller screen which the surgeon can see very minutely. Okay, so these are the different kinds of surgery, and these are, you can say, the most modern type of surgery. Now, like I told you, there are certain words in the textbook. So let us try to understand what these words mean. So there is something called as bloodletting. So what is the meaning of bloodletting? Now here it is a typical picture of a hospital in the ancient days. So this is a hospital. All right. Now this hospital is very different from the kind of hospital that we see in today's times. Today's hospitals are all posh and they have lots of doctors in uniforms and they have so many, you can say, facilities in the hospitals in today's times. But look at this particular hospital here. Someone is doing a particular procedure somewhere in the corner, also near the window. Can you see? I think they are doing something in with the mouth of the patient. They're plucking a tooth, I suppose. And the other person here in front of you is doing something which is called as bloodletting. So in case there is a wound, or in case they feel that there is some kind of septic thing in your body, they drain the blood from your body. Okay, from that particular part they will let the blood drain, the bad blood, they say. That is called as bloodletting. Let's look at one more picture of bloodletting. See here, and you can see how distressed the patient looks, because the patient has not got any kind of anesthesia. So when he has cut open his skin, he must be feeling so much of pain. Can you imagine? See, he's held tightly to the doctor and his face is showing his pain. So this is a process called as bloodletting. Then there is another process called as plastic surgery. Now what is plastic surgery? Plastic surgery is done in order to change your looks, or in order to alter your looks according to your need. Now some people, they feel, oh, my nose is not straight, or my lips are too thin, okay, my chin is very wide. So in case you have these kind of problems, and in case you have a lot of money, then you can go in for plastic surgery and you can do so lots of corrective measures on your face and you can make yourself look beautiful again. Okay, plastic surgery is available to you. Sometimes, unfortunately, some people, they suffer from burns or they are in an accident and their looks are spoiled. Now look at this child here. I think he has been in some kind of accident involving fire and his skin has got burnt. See, you can see how his skin is angry and red and it is full of knots. Now that is before the plastic surgery. Once plastic surgery is conducted on him, then see how his skin has become smooth again. So what they do is they remove skin from other parts of the body and they graft it here or they paste it here. And of course the skin is a living thing, so it keeps growing on yourself. All right, and it is your own skin, so your body does not reject it also. So this is the meaning of plastic surgery. So these are all new terms, children, for us. Okay, that is why we are discussing the meanings along with the pictures. Let us look at one more new term. So we have a term called pericardium. Now what is the meaning of pericardium? Now you can see your heart here. Okay, this is your heart. And in the second picture, you can see a kind of plastic covering kind of thing, which they have peeled away from the heart. That covering on your heart is called as the pericardium. What is it? It is the covering on your heart. And it is called as your heart is covered by a thin, you can say, sheet of some kind of material. All right, like plastic. So that is called as pericardium. Now, if many of you chooses, last time I remember I told you that when you see this lesson, you will either decide that yes, I like all this, so let me become a doctor, or you will decide, oh no, all this is too painful for me to watch. There is a lot of blood and there are so many things which I don't want to see. Okay, so you will be able to decide whether you like it or not. So what is this? This is the pericardium, or it is a covering or the sheet which covers your heart. Then see, these are the heart walls. I told you every heart has got walls. So what do the walls do exactly? They do not allow the blood to mix. You know, in your heart you have good blood, bad blood. So they do not allow the bloods to mix. Okay, and they regulate or they control the flow of blood. So we have the different kind of valves. You need not remember the names. You can just look at this picture. Okay, these are the valves in your heart. So you have the pulmonary valve, the tricuspid valve, the aortic valve, the mitral valve, etc. So these are the different valves in your heart. Then we have to discuss what the meaning of a tumor is. All right. Now we have read that in neurosurgery, sometimes people have got tumors. So see, tumors can occur in any part of your body. So this person, he's got a tumor on his lip. So what is this tumor exactly then? The tumor is some kind of unwanted growth. Okay, some growth on your body which you do not want. So that is a tumor. Tumors can sometimes be dangerous also if they come up in the wrong place. For example, see here, this person has got a tumor in his brain, and you know your brain controls all the other functions of your body. So in case you have a tumor inside your brain, then imagine it might affect so many other functions in your body. You might not be able to see sometimes, you might not be able to walk, you might lose balance. Okay, so these are tumors. Tumors means they are unwanted growth, and then the doctors, they try to remove this tumor from your body. Then we have the Cushing clips. So these are the Cushing clips. Now the Cushing clips are named after a particular doctor called as Harvey Cushing. He is supposed to be the father of modern neurological surgery, and he developed these basic instruments when you perform operations on the heart. He developed these instruments so that the patient does not bleed and die. Sometimes, because of bleeding, because there is a lot of blood loss, the patient can sometimes die. So because of these particular instruments, these particular clips, there was a lot of improvement, and people, the mortality rate, it rose from 90% to less than 10%. That means in heart operations, out of 100 people, 90 people used to die. But then later, now it is even lesser. Okay, now people do not die at all after a brain surgery. Okay, but then it is because of all these things that he developed. For example, this Cushing's clip. So that is why it is called as Cushing's clip, because it is Harvey Cushing, the surgeon, who developed these clips. All right. See here, he is Mr. Dr. Harvey Cushing, and that is why the clips are named after him. They're called as Cushing's clips. Okay, his name was Harvey Williams Cushing. So this was about the lesson, and this was about the main terms in the lesson. Now let us talk a little bit about the comprehension of this lesson. That is how much you have understood. So you're supposed to read the lesson and name the following. So do one thing now, pause the video and read the lesson and try to find out answers to these. So who was the first surgeon to perform operations? It was Sushruta. He was called as a father of surgery. Anesthetics used from mid 19th century. So which are the two anesthetics? I just named them. Yes, they are ether or chloroform. Who was the first successful cardiac surgeon? So did you locate that in your textbook? It is Daniel Hale Williams. What is the sac or the covering around the heart called? It is called as the pericardium. Who is the father of modern neurosurgery? It is Harvey Cushing. And which is the world's most advanced surgical robot? It is the Da Vinci. So there is a particular robot called as the Da Vinci, which is the most advanced surgical robot in the world. Okay. Now let us try to match these also. So tooth extraction means what? It means to remove a decayed tooth. Cardiac means what? Yes, it is related to the heart. Sedative means a substance that makes a person sleep. What is tumor? It is an extra growth or unwanted growth in your body. Incision means a cut which is made for surgery. A console means a control unit for robotic surgery. 3D means a three-dimensional, having length, breadth and depth. And what is a Cushing clip? It is a device which is used to stop blood loss in neurosurgery. So we have all the answers here for you in front of your eyes. Okay. Now let us go to one more exercise in comprehension where you're supposed to fill the web with words related to surgery. So there are major is a word related to surgery. We say major surgery. Then we can also say anesthetics is a word related to surgery. Why? Because it is a kind of a drug which is used in order to put the patient to sleep. Then we have complicated, cardiac, robotic. Okay, you can find out any other word also of your choice. and add it to the web. Then you're supposed to write 3 to 4 lines about the following in your own words. So what is the Sushruta Samhita? So the Sushruta Samhita is one of the oldest works in the world dealing with surgery. So it is a kind of compilation, you can say, or a kind of a book which is written by Sushruta about his work in surgery. So you will find everything related to ancient surgery in this particular book. First cardiac surgery was performed on a patient called James Cornish, who was suffering from a serious knife wound. Who was the first neurosurgeon? It was Harvey Cushing, who's supposed to be the father of modern neurological surgery. He developed basic techniques and instruments for operating on the brain as a distinct and surgical specialty. Now, what is the meaning of robotic surgery? Is a type of minimally invasive surgery. Now, these are things or sentences which I have written. Okay, if you want to write some sentences on your own, you're welcome to do that. Now, let us go to the last part of our lesson where we are going to look at adjectives. Okay, so what are adjectives, children? Adjectives are words which describe the noun. It tells us about extra qualities of the noun. And these adjectives, they can be in different degrees. And therefore, the degrees of comparison is related to adjectives. And today we are going to talk about degrees of comparison. So when you want to compare two things, what do? We compare their qualities and we decide which is better, which is not good. So when you're comparing in this way, there are 3 degrees that you use. One is the positive degree, one is the comparative degree, and the other one is the superlative degree. So these are the 3 degrees of comparison. Okay. Now we will look at each of them separately and we will look at a lot of examples also. So what is a degree of comparison? It is possible to change the degree of comparison of an adjective or an adverb in a sentence without changing the meaning of the sentence. So how can you make this kind of comparison? How can you make this kind of changes? So these kind of comparisons can be made using the 3 forms of the adjective. That is the positive form, the comparative form and the superlative form. So what is the positive form, children? We use the positive degree when we speak only about one person or one thing. You're talking about one particular person, you're talking about one particular thing, you use the positive degree. For example, see, we say James is tall. So you're talking only about James. You're not comparing James to anyone else. The house is big. So we are talking about one house and you're telling people that the quality of that house is that it is big. This flower is beautiful. So what kind of flower is it? It is a beautiful flower. So see, these are some qualities of these particular things. Alright. And there is only one person or one thing which is involved over here. That is why it is called as the positive degree of comparison. Let us move on and talk about the comparative degree. Now compare. To compare, you need 2 things or more than 2 things. You cannot compare with just one thing. Alright. So when we compare 2 persons or things with the adjective changing its form, you use the comparison. When you compare, what do? You use the adjective. Then it is called as the comparative degree. Look at the example. Taller, bigger, fatter, thinner, etc. So you're comparing. Now there are 2 people here. So we say A is taller than B. First we said James is tall. There was only James. Now we are saying James is taller than Robin. So you're comparing James with Robin. Okay, so it becomes the comparative degree. And then you have the superlative degree. Super means the greatest, the biggest, the best. When we compare 3 or more things and the adjective is in the superlative form, it is called as the superlative degree. For superlative, we always use the word the. So we say the tallest, the biggest, the fattest, the thinnest. Okay, we add the word the. That means it is the only one. There is nothing else in comparison to it. So which are the 3 degrees of comparison that we saw now? The positive degree, the comparative degree, and the superlative degree. Let us look at some examples. Now, everywhere you cannot follow the same rule. Okay, see, look at these examples. I will leave you with a lot of time to read this. Now, some places you add ER, some places you add only R, some places you do not add the R, but you add more and the most. Okay, so there are a lot of differences. Some places when there is a Y, you drop the Y and you add the IER. So this is how the degrees of comparison are written. All right, we have already learned about these degrees of comparison since we were in the younger classes. So we know what these degrees of comparison are. So I will not take time to read all the examples. So you can pause the video here and read it. Let me read the first few for you. So confused is more confused, the most confused. Okay, see, dirty is dirtier, the dirtiest. Here we did not say more dirty, most dirty. Okay, then you can see fast here. Fast is faster, the fastest. Whereas just above it we have far, where it is farther and furthest. So it is as long as distance is concerned. Okay, far, farther, and space is concerned, furthest. All right. So take your time and read this carefully and try to come out with the differences in the different words. Okay. Now we come to the exercise in your textbook. So you have to fill in the gap with the degrees of comparison. So in each column there is one word which is given to you and it is in different columns. That is, in the first one you have the superlative degree which is given. In the second one you have the comparative degree which is given. So come on, find out the answers and write it and then come and check with mine. So the first one you have old, older, the oldest. Then you have healthy, healthier, the healthiest. Near, nearer, nearest. Fine, finer, finest. Then you have early, earlier, earliest. Small, smaller, smallest. Fast, faster, fastest. High, higher, highest. So you saw how we completed the table and we filled in the different degrees of comparison here in this particular table. Now this is the last exercise as far as today's lesson is concerned. So here we have a little bit more information about adjectives. Now when you read the table, children, we realized that in some adjectives, instead of ER or instead of R, we write more and most. So what is the secret there? So adjectives which have more than 2 syllables, that is adjectives which are long words, they take more and most before them. For example, see, successful is the positive degree. Now, successful is a big word. It has got more than 2 syllables. So, the comparative degree becomes more successful. Comparative degree. Most successful. Superlative degree. Okay. Now, find out and write the comparative and superlative degrees of all these words. And then come back and check your answers with mine. Ancient, more ancient, most ancient. Special, more special, most special. Significant, more significant, most significant. Advanced, more advanced, most advanced. Accurate, more accurate, most accurate. Remember, whenever you write the superlative degree, always add the word the there. So it will be the most ancient, the most special, the most significant, the most advanced, and the most accurate. Alright, so this was a rather long lesson. We did part 2 of lesson number 4.2, Revolutionary Steps in Surgery. And in today's part of the lesson, we looked at the content of the lesson with a lot of beautiful pictures. Children, now this is actually a lesson which is in the English textbook. It is related to science, but remember, it is not a science lesson. What are we doing here? We are trying to understand the vocabulary related to surgery, or words which are related to operations and surgeries. So it is a English lesson which is trying to teach us vocabulary related to surgery. So hope you enjoyed the lesson and you had a good time watching the pictures also. So that is all for now. Thank you so much. So children, now you have watched the video. So after you watch the video now, you will have to complete a few simple tasks. Now you might have watched the video on your computers or your laptops or your mobile phones. Now after you watch the video, what will you do? You will please go to the description box which is given below the video. So what is the description box? See, the description box looks like this. Alright, and after you go to the description box, you will see that there are a few questions there. Now what are these questions about? These questions are about the lesson that we just learned or the video that you just watched. So what will you do? You will think back properly about the lesson and you will try and answer these questions and note down the answers in your notebook if you want. Okay? After that, we have another task waiting. You will also click on the link which you will find in the description box to fill up the Google form. So now what is the Google form, children? It is nothing but a simple form. There are a few simple questions there about the video which you just saw and also about yourself. So these are the tasks now that you will have to complete after you watch each video. So children, wasn't that a very interesting lesson? I'm sure you learned a lot of new things in this lesson. If you have liked this video, please hit the like button and also subscribe to my video so that you will get to see all the videos which I keep posting regularly.